It's 9:14 on a Tuesday morning. Sandra is sitting at her kitchen table. In front of her, a coffee that went cold almost an hour ago, and an envelope from Medicare she still hasn't opened. She already knows roughly what it says, because last month's letter said almost the same thing, just with a slightly smaller number. Here's the number inside that envelope. $14,600. Not a fine, not a one-time fee. A number that gets a little bigger every single month for the rest of her life. Sandra turned 65 3 years ago. She'd just retired. She had health coverage through her old employer's retiree plan. The same card, the same doctors, the same premium she'd paid for years. And she assumed, like almost everyone does, that retiree coverage was basically the same thing as having Medicare. It wasn't. And that one assumption is what's sitting in that envelope right now. My name is Chloe, and on this channel we break down the quiet financial decisions that drain people's retirement, the ones nobody flags until the bill shows up. If you're 60, 64, about to turn 65, or you have a parent in that window, stay with me. Because what's inside Sandra's envelope is the most expensive mistake in retirement, and almost nobody explains it before it happens. Let's open it. Here's why smart, careful people miss this. Medicare isn't one program. It's 4 parts, 2 completely separate penalty systems, and exactly one 7-month window. And the government assumes you already know all of it walking in. In 2026, the standard Medicare Part B premium is $202.90 a month. That's the baseline, the number everyone starts at. Here's where it gets expensive. For every 12 months you go without Part B and don't qualify for an exception, your premium goes up 10%. Permanently. Not for a year. Not until you catch up, for as long as you're on Medicare, which for most people is 20, 25, even 30 years. Miss it by 1 year, that's 10% forever. Miss it by 2, 20%. Sandra missed it by 3 years. That's 30%, added to $202.90 every single month. An extra $60.87. Multiply that by 12 months, by 20 years of retirement, and you land on $14,600. That's the number in the envelope. And Part D, your prescription drug coverage, runs on its own separate clock. 1% of the national base premium for every month you went without creditable drug coverage, added to your bill, also forever. 2 different programs, 2 different penalties, both permanent, both compounding quietly in the background of a life that otherwise looks completely fine. Here's the window you're actually working with. Your initial enrollment period opens 3 months before your 65th birthday, includes your birthday month, and closes 3 months after. 7 months total. Miss all 7, and your only path back is the general enrollment period, January 1st through March 31st, with coverage that doesn't even start until July. That's months of exposure, plus the penalty waiting on the other side, permanently. Now here's the trap that caught Sandra. And statistically, it's the one that catches the most people, because it doesn't feel like a trap at all. If you're still actively working and covered by a current employer's group plan, yours or your spouse's, you can usually delay Medicare penalty-free through a special enrollment period. The keyword is current. Retiree health plans don't qualify. COBRA doesn't qualify. If your coverage comes from a former employer, even if it's the exact same plan, same card, same network you had the day before you retired, Medicare doesn't count it as active coverage. The 7-month clock starts on your 65th birthday whether you open that envelope or not. Sandra's retiree plan looked on paper identical to what she'd had for 15 years. Nothing changed, except that quietly a window opened and closed, and nobody on either side of that mailbox said a word. Before we go further, here's the map you actually need. Medicare has 4 parts, and inside that same 7-month window, you're making a decision about all 4, whether you realize it or not. Part A covers hospital stays, inpatient care, skilled nursing, hospice. Most people get this with 0 premium, as long as they paid Medicare taxes for at least 10 years. Part B covers everything outside the hospital: doctor visits, outpatient procedures, preventive screenings. This is the one with the premium and the one with the penalty we just walked through. Part C is Medicare Advantage, private insurance that bundles Parts A and B together, often with extras like dental and vision thrown in. Part D is prescription drug coverage, with its own enrollment, its own penalty, completely separate from Part B. One way to keep it straight: Part A is your hospital shield. Part B is your access to doctors. Part C is the private all-in-one bundle. Part D is your pharmacy protection. 4 parts, 1 window. And the next decision, Original Medicare or Medicare Advantage, is the one that quietly decides almost everything else for the next 20 years. This is the decision the commercials spend the most money on and explain the least. Original Medicare is run directly by the federal government. You pay that $202.90 Part B premium, and in return, you can see almost any doctor or specialist in the country who accepts Medicare. No referrals, no networks, no permission required. The trade-off is real. Original Medicare has no out-of-pocket maximum. A serious surgery or a long hospital stay can generate bills with no ceiling, which is exactly why most people pair it with Medigap, coming up next. Medicare Advantage, Part C, is sold by private insurers: Humana, Aetna, United Healthcare. It bundles everything into one plan, often advertised at a $0 premium, with an annual out-of-pocket cap that Original Medicare doesn't offer. On paper, it sounds like the better deal. Here's what the commercials leave out. In 2026, nearly 2.9 million Medicare Advantage members, close to 1 in 10, were forced to switch plans because their insurer simply exited their market. That's roughly 10 times the rate from just a few years ago. 231 fewer $0 premium plans exist this year compared to last. And many of the extras that sold the plan in the first place, dental allowances, vision coverage, the over-the-counter spending card, are being quietly trimmed or cut across the industry, mid-contract. So choose Original Medicare if you travel, want access to any doctor anywhere, and want coverage that doesn't change shape every January. Choose Medicare Advantage if you're healthy, comfortable inside a network, and your local plans have actually stayed stable, not just this year, but for years. Here's the piece almost nobody at 65 has ever heard of, and the one that decides whether no out-of-pocket maximum is a real risk or a non-issue. Medigap, also called a Medicare Supplement Plan, is private insurance that sits on top of Original Medicare and covers the deductibles, co-pays, and coinsurance that Medicare leaves behind. In 2026, Medigap premiums range from $61 to $354 a month, depending on your age, your state, and the plan you choose. The most popular option for new enrollees is Plan G, averaging around $220 a month at 65. Plan G covers nearly everything Original Medicare doesn't, with one exception: the annual Part B deductible of $283. After that, Plan G picks up the rest. No surprise bills, no out-of-pocket catastrophes, just predictable covered costs. Now, the rule that matters more than almost anything else in this entire video. Your Medigap open enrollment window is 6 months, starting the month you turn 65 and enroll in Part B. Inside that window, insurers cannot deny you, cannot charge you more for a pre-existing condition, cannot make you wait. It's called guaranteed issue, and it's the best deal you will ever get on health insurance, full stop. Miss that window, and insurers can run full medical underwriting, charge dramatically more, or deny you outright based on your health history. One more thing. If you're enrolled in Medicare Advantage, you cannot have Medigap at the same time. Switch later and you're back under underwriting, starting from zero. Now, the 3 mistakes that cost people the most. And 3 blocks from Sandra, on that same Tuesday morning, a man named Robert is opening a very different envelope. Robert turned 65 last year. Same kind of retiree plan as Sandra. Same assumption almost everyone makes walking into this. The only difference, 4 months before his birthday, Robert called his old employer's HR department and asked exactly one question. Does this plan count as creditable coverage for Medicare? The answer was no, so he enrolled in Part B on time, and during his 6-month Medigap window, he bought Plan G. No underwriting, no denial, guaranteed. Same situation as Sandra, one phone call apart. Mistake number 1, choosing a plan based on the premium alone. A $50 a month plan with a high deductible and a thin network can cost far more in a bad year than a $200 plan with real coverage. Always run the worst case, premium plus deductible plus max out of pocket, not just the sticker price. Mistake number 2, signing up for Medicare Advantage without checking that your specific doctors and hospital are contracted with that specific plan. Not just that they accept Medicare in general, that specific plan. Networks get rebuilt every single year. A doctor who is in network in January can be out of network by December. Mistake number 3, waiting on Medigap. Once that 6-month guaranteed issue window closes, underwriting kicks in. People who were perfectly insurable at 65 get priced out, or denied outright by 68. Robert didn't wait. That 10-minute phone call is the entire distance between his envelope and Sandra's. Back to that kitchen table. The coffee is still cold. The envelope is still sitting there, unopened, exactly where it was a few minutes ago. Except now you know what's inside. And more importantly, you know it didn't have to be. Here's your 3-step checklist if you're 64 right now. Step 1. Mark the date. Count back 3 months from your 65th birthday. That's the day your 7-month window opens. Set the reminder today, not next year. Step 2. Make the call Robert made. Whoever your coverage comes from, a current employer, a former employer, your spouse's plan, ask the exact question. Is this considered creditable coverage for Medicare? And get the answer in writing. Step 3. Before you choose anything, compare original Medicare plus Medigap against Medicare Advantage using worst-case numbers, not just the premium. And if you go with original Medicare, buy Medigap inside that 6-month window, even if you feel completely healthy today. Sandra's penalty is 30% permanently, $60.87 every month, $14,600 over 20 years. For a phone call that takes about 10 minutes, the math isn't complicated. The window isn't complicated. What's complicated is that nobody opens that envelope for you ahead of time and tells you what's written inside. If you're 64 or 65 right now, go to Medicare.gov or call 1-800-MEDICARE. The information is free. The silence isn't. If this video helped, subscribe. Every week we open envelopes like this one before they become a problem. And tell me in the comments, are you already enrolled or still planning for 65? I read every single one. This video is for educational purposes only, and any results depend on your own decisions and actions.